Are you struggling with the ACLS algorithm? It seems overwhelming? Well, this is the mnemonic for you. I want to make the ACLS process a little bit easier. Please refer to the American Heart Association for the full algorithm. This is just meant to be a supplement for learning the algorithm. Because when you're in a high pressure situation, sometimes your mind goes blank. So we're going to start. I have it all written down here. I used AI to help. This is the first time I've used AI to truly help me make a mnemonic. So if you like it, please like this video. It might help me want to come back and make more videos. But right now I've been focusing on my family and my job. But I do miss making videos like this. Here is the mnemonic. Come zap the elephant and alligator while hunting hidden treasures. What does that mean? The first part is the come to the rescue part. So let's start with the C. Okay. Commence high quality CPR. Shout out to Dr. Mike. Compressions. That's going to be your first step, because we need to get the blood circulating, because, you know, their heart is not pumping blood to the body like it's supposed to. So you're going to want to start these compressions at 100 to 120 per minute. You know, staying alive. O, oxygenate. Okay, we're going to attach the high flow O2 and, you know, get the airway person up on the airway. Get some, when you're pumping the blood and they're not breathing anymore, we need to get oxygen to the blood and then circulate that around the body, because the brain doesn't have very long before permanent brain damage starts. All right, so M, monitor and defibrillator. And yes, I'm just going to read it right off of here. Sorry, it's not perfectly edited like all these other videos. This is a real life video as a father of 5 kids, and I have probably about 20 minutes of spare time before someone comes banging on this door. And if it is, I'm just going to leave it in the video. So we're going to attach the AED, we're going to attach the monitors, we're going to check their rhythm and see whether or not they're in a shockable rhythm or if they're in a non-shockable rhythm. We will go over those as well later on, but for right now, just get some monitors attached. So that's the M. Okay. E, evaluate the rhythm. So what are we looking for here? Okay, shockable versus non-shockable. We're going to get into those in just a minute here. But so the first part of this, come zap the come zap the elephant and alligator while hunting hidden treasures. Come is the first part of this. Don't take that the wrong way, please. Someone will, but whatever. You're going to come to the rescue right away. So those are the 4 first main steps of this mnemonic. All right, so now we're going to move on. Zap the elephant and alligator portion of this mnemonic, okay? This is looking for shockable rhythm pathways right now. It's going to be a loop cycle that we're going to go through here. When the initial rhythms, if we see VFib or pulseless VTach, okay, that's something that's going to be within the algorithms that you know are shockable rhythms, okay? So what are we going to do? We're going to zap the elephant and the alligator. Now, what does that mean? So let's go for zap. If you see VFib or you see pulseless VTach on the monitor, we're going to start with a shock, okay? And if you have an AED, it's going to automatically utilize that, or it's automatically going to tell you that this is a shockable rhythm. It'll charge, clear, everyone's staying clear, make sure everyone gets away, including the airway person. Don't keep everyone's gonna have to get away. Okay, no one wants to get shocked besides the patient. Biphasic, we're looking at 120 to 200 joules, and monophasic, we're looking at 360 joules. So that is the zap portion. Zap with the shock, defibrillate immediately. Biphasic, 120 to 200 joules, or monophasic, 360 joules. Then resume CPR, okay, for 2 minutes. We're also going to be looking to establish IV and or IO access during this time, because we're going to need to start thinking about pushing medications as soon as possible. Another thing we're going to be doing is considering an advanced airway that has capnography on there as well. Elephant. What does elephant stand for? Epinephrine. Okay, we're going to be looking to 1 milligram IV or IO every 3 to 5 minutes during CPR. So for elephant, remember epinephrine, 1 milligrams, IO, IV, whatever access you have, every 3 to 5 minutes, okay? And is just another round of CPR. Compressions. Make sure they're high quality. Make sure you're rotating compressors, because it is very easy in the heat of the moment to forget to switch rolls. That's another big point I want to remember too, is make sure you're getting fresh compressors in there so we can deliver the highest quality CPR, because that is what's moving blood, around the body. And if we're not doing it properly, at least 2 inches deep, 100 to 120 beats per minute, Staying Alive or whatever song that, has that beats per minute, you can use that. It is okay as long as you're in that range. So alligator's up next. That is amiodarone. Okay, that's 300 milligrams IV, IO, whatever kind of access that you have is the first dose. If you're still dealing with, VFib or pulseless VTAC and it's refractory, then the second dose of amiodarone is going to be 150 milligrams. Repeat zap is needed. Shock after each 2-minute CPR cycle if indicated. Now, for non-shockable, if you move into a non-shockable rhythm, the mnemonic for that is PER, P-E-R, and we're going to get into that pathway here soon. Before we hunt for hidden treasures, let me talk about the PER mnemonic that I haven't found a way to fit into the zap. I haven't found a way to fit it into this mnemonic yet, but it's part of it somehow. But if the patient moves into, say, a flat line, asystole, if they move into pulseless electrical activity, we are going to repeat per ROSC, or return of spontaneous circulation. ROSC means that, okay? So if they're flatlined or pulseless electrical activity, the patient they're not going to get any worse than that. So at this point in time, we're going to pump with CPR, okay? Continuous 2-minute cycles. Epinephrine is the E in this. 1 milligram IV or IO, whatever access you have, every 3 to 5 minutes. And then the R in PER is reevaluate the rhythm every 2 minutes. If it becomes shockable, then what do? You move to the ZAP, the elephant, and alligator pathway. And remember, this is not an all-inclusive. There are other pathways. The American Heart Association pathway, ACLS pathway, is a lot more complex than this. This is just meant as a supplement guide to when you get into an emergency situation. Sometimes people's minds go blank. So if you can remember, come zap the elephant and alligator while hunting hidden treasures, at least you can have that in mind, and it can get you back onto your more elaborate pathways after that. If you move into the non-shockable pathways, you're going to use PER. Pump with CPR, epinephrine, 1 milligram every 3 to 5 minutes, and reevaluate the rhythm every 2 minutes. If it becomes shockable, you can switch to the ZAP, the elephant, and alligator pathway. Now, sometimes it's not going to move back into the shockable rhythm, so you're going to have to assess, usually the doctor, or in my case in the OR, an anesthesiologist would be the one who would make the call to call it. So that does happen sometimes. But if you know that you tried your best and did everything in your power to save that patient, then that's one of the most powerful things you can do for yourself too, in knowing that you gave the best care that you could to this patient, and not everyone is able to come back from cardiac arrest. Hunt for hidden treasures. This one's just a big reminder that you need to actively search for the underlying causes of this arrhythmia, okay? And what are some of the underlying causes of arrhythmias, okay? We have our H's and our T's. We have 5 H's and 5 T's. This will be on the ACLS, American Heart Association ACLS algorithm, okay? So H's, we have hypovolemia, hypoxia, hydrogen ion, acidosis. We have hypo and hyperkalemia, and hypothermia. For our T's, we have toxins, tamponade, cardiac, tension pneumothorax. We have thrombosis, coronary, and then we also have thrombosis pulmonary. Okay, so this one, what I want you to, the hunting for hidden treasures, just remember, what could be the underlying cause for this that you're looking for during this resuscitation attempt, okay? That is my mnemonic. I utilized AI to create it. If you found this a little bit helpful or would like more of these and want me to come out of retirement to make more, please like this video, like and subscribe. And once again, thank you for watching and listening.